Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Naima develops Biotech total RNA extraction kit, which could standardize COVID-19 testing in the country. Ogun State government challenges the state's public service to rise up to the socio-economic realities occasioned by the COVID-19 pandemic. And the United States buys almost all the world's upcoming supply of COVID-19 treatment drug remdesivir. We begin with the breaking news from Delta State that the governor, Dr. Ifeanyi Okowa, and his wife have tested positive to the coronavirus. The governor announced this on his Twitter handle today, saying him and his wife are well and remain in isolation. In his words, "My wife and I have tested positive for COVID-19. We are well and continuing with our isolation and medication. We thank you all for your continued prayers for us and our daughter." From the Nigeria Center for Disease Control, NCDC, the country recorded 561 new COVID-19 cases confirmed in 18 states across the country and the Federal Capital Territory. According to its latest figures, the total confirmed infections now stand at 25,694, with 9,746 patients discharged, while the number of deaths has risen to 590. While Lagos has 200 of the 561 new cases, Edo has 119, Kaduna and the FCT each have 52, Niger 32, Ogun 19, Ondo 16, Imo 14, Plateau 11, Abia and Oyo each have 8, Bayelsa 7, Katsina 6, Kano 5, Bauchi, Osun and Kebbi 3 each, Borno 2 and Jigawa 1. States with the highest cases in each of the 6 zones are Lagos in the southwest, with cases now at 10,510, the FCT in the north center with 1,870, Kano in the northwest with 1,216 cases. Once more, Edo takes over Rivers in the south-south with 1,105 cases. Gombe and Bauchi now lead in the northeast. Both states have 503 cases each, while Ebonyi still tops in the southeast with 438 cases. The Federal Executive Council meeting is holding at the State House, Abuja. It's a virtual meeting, and those in attendance are the President, the Vice President, other members of the Council that can be seen physically wearing their face masks. We also had all the members joining via video conference. This is one of many virtual FEC meetings the President will be holding following the coronavirus pandemic outbreak. And 172 evacuees from Uganda and Nairobi have arrived in Nnamdi Azikiwe International Airport, Abuja, at 10:20 a.m. local time today via Air Peace Flight B777-200 from Nairobi. Some of the evacuees will disembark in the nation's capital. Others will proceed to the Murtala Mohammed International Airport, Lagos. The exercise was put together by Nigeria's mission in Nairobi, Kenya, in collaboration with the mission in Kampala, Uganda. All evacuees who tested negative to COVID-19 will now proceed on the 14 days self-isolation as mandated by the Nigeria Center for Disease Control, the Federal Ministry of Health, and the Presidential Task Force on COVID-19 regulations. Now, the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Liu, has been speaking on the data and science following the modifications to the extension of the second phase of the ease of lockdown. Dr. Liu assures that there will be a safe reopening of schools for the students in graduating classes to resume in person and write their examinations. He was speaking during our breakfast program, Sunrise Daily, today. Now, Dr. Ainoye Komi is a chief consultant with the Federal Neuropsychiatrist Hospital, Biotech, and she joins us now here in Lagos. Thank you for joining us on the program.
Thank you for having me.
I'd like to begin by asking, how can Nigerians not panic at this point? We're being told that we haven't peaked, the curve is still, upwards, and yet we're having these extensions and modifications to the ease of lockdown.
It's okay to be afraid because of the nature of the problem, because we don't still know everything about the virus. But is there a cure? Yes, there is no cure, but yes, it can be prevented. What I want Nigerians to do is obey safety measures. Wear your mask, wear your face shield, wash your hands, use hand sanitizer, obey social distancing like we are in the studio now. If you obey this, you are not likely. The likelihood of you contracting the virus is very, very remote. So there's no reason to panic, really. But the problem with Nigeria is that there are still some people who don't believe that the virus is real. And then even the government, when they pass messages to the people, sometimes they do things that even conflict their messages. Yes. So the people are confused. You are telling them that, okay, don't do this. But the government officials, they do what they are saying people should not do. So would we blame the people when they feel that what is COVID real? So you see, when you want people to comply, the messenger and the message are both important. So who are the messengers? Because now Nigerians see that this thing is politicized. So we should put the right messenger there. Now, most times it's the politicians that are talking about COVID. I mean, when they're announcing, oh, we have so cases, we have number of cases today, do this, do that. Why not allow professionals to talk to people? Why not allow them to educate people? Because, you see, there is a science to compliance. It's not just arbitrary. It's not just about talking.
Let's talk about, how this affects education, especially the impact. Parents who are a bit worried that, their wards who are writing final examinations will have to go through, and some of these students are supposed to travel also to some of their centers.
Yes. Ideally, the school environment is supposed to be a place of refuge, a place of safety, a place of security, a place of fun. But now everything is going to change. It's like the students will be operating in silos. You can imagine in a class, maybe there used to be like maybe 50 or 60 students in a class. Now, according to the plan they have, if they're going to enforce that plan, that means in a class, we won't have more than maybe 10 or 15 or 20 children there. And each person will be seated, very, very far, which is normal. But this might have a negative impact on the children's social and emotional development, because the social texture is now thinning out. Because children thrive, when they are able to interact with each other, when they are able to jump, when they're able to play, when they're able to talk, when they're able to be free. So now it's like each person is in a straitjacket. That's number one. Then any place of gathering is automatically a high-risk zone. So the school now has become a high-risk zone. So parents, yes, they should be worried, but kit your children very well. Ensure that you educate them. Tell them that this thing is real. But my own fear is the parents that don't believe that there's corona. So by extension, their children too will not believe. So these children might even be mocking the people, the children that wear face masks. Even me as an adult, sometimes I go to places and it's as if I'm the only one wearing face mask. And people will be looking at you as if you are doing something very, very odd. And such children who believe that there is COVID might even be bullied. And if they are, it's going to negatively impact on their mental health. So now my advice to teachers, please ensure that you look out for signs of mental decompensation in children. So it's not only just teaching them chemistry, physics, and maths. You also have to look out for their psychological stability.
All right. Dr. Ainoye Komi, Chief Consultant with the Federal Neuropsychiatrist Hospital, Bogota. Thank you so much for joining us on the program.
Thank you for having me.
It's some encouraging news from the health sector on speeding up COVID-19 testing as the Nigerian Institute of Medical Research, NIMR, says it has developed a new total extraction RNA kit. According to the Director General of the Institute, the device called NIMR Biotech Total RNA Extraction Kit could standardize COVID-19 testing in the country and get many more tests done. The RNA extraction kits have been scarce due to the need all over the world in battling the pandemic.
Since COVID-19 pandemic, diagnosis of COVID-19 has been by PCR testing. And using the PCR requires that you extract the RNA of the virus, amplify it, before you then do a detection test that says it's positive or it's negative. Now, along the line, because a lot of countries are now doing the test, RNA extraction kits became very scarce. And so everybody is just producing one thing or the other, and they bring it. So when one finishes, we just use another one that they give us. So from there, we felt that we should be able to develop our own through research. So we started working on it. And one of the things that made it a challenge is that a few of the reagents has to be brought from UK or China. And there was a ban on international flights. So it became difficult for those. Sometimes we get the reagent. By the time the reagent came, it was already denatured and was not useful.
Well, Professor Rosemary Aldo is from the Nigeria Institute of Medical Research, NIMR, and she joins us via Skype. Thank you for joining us at this time. Tell us what this means in the COVID-19 fight. What is this total extraction RNA kit? Is it a rapid test kit, and has it been validated?
All right. Thank you very much for having me. The extraction kit is not a rapid test kit. Part of the steps that is involved in testing using the PCR, the qPCR that is in use right now is once you get the sample, you have to extract the nucleic acid before you use it, you test it with a kit. So that loop was where we're having challenges, Extraction kits became quite scarce at a point. And then even though we have the test kits, the qPCR kits, the PCR kits, but we're unable to extract the nucleic acid before doing the testing. And that's the gap that we now decided to fill. And so these kits we have developed has been validated. It was validated here in NIMR and at the College of Medicine, University of Lagos. And it was very good.
So do we have all of the reagents, for this? Because I believe it was mentioned that reagents are needed to be imported, but are we thinking about producing them?
Yes, we have the reagents here. There are a few things we need to import, but we have reagents that can do up to 10,000 as at this moment.
Okay. In terms of standardizing the tests, will this apply only in Lagos, or do you hope that this is something that all other states can key into?
Oh, we have enough that we can supply all the states. As many as need it, we have enough to supply them, yes.
All right. We'd like to thank you, Professor Rosemary Audu, Director of Research, NIMR. Thank you for joining us on the program.
It's a pleasure. Thank you.
We'll have more on the COVID-19 updates when we return. Stay with us. The Ogun State Governor, Dapo Abiodun, has challenged the state's public health service to adequately rise up to the socio-economic challenges occasioned by the current coronavirus pandemic by redoubling their efforts towards the state's economic recovery. He made the call in Abeokuta, the state capital, while swearing in the 17th and the 5th state newly appointed head of service, the Commissioner for Transport, and 2 special advisors. Giving his charge during the ceremony, the governor promised reforms in the public service to ensure effective service delivery to the people in the state. And as many countries around the globe race to find a permanent solution to the pandemic, the United States has secured almost all the world's upcoming supply of the drug remdesivir. The drug is the first to be approved by authorities in the U.S. to be used to treat COVID-19 and has shown to help people recover faster from the disease. This comes as the global number of confirmed cases surpasses 10.4 million, with over 500,000 deaths and 5.3 million recoveries.
The United States says it has struck an amazing deal with the firm Gilead Sciences, makers of the drug remdesivir, that's been approved by authorities to be used to treat. A statement from the Department of Health and Human Services says the Trump administration has secured almost all the world's upcoming supply, buying 500,000 doses, which amounts to 100% of Gilead's production in July, 90% of it in August, and 90% in September. Vice President Mike Pence hails the progress on coronavirus treatments, being optimistic on the development of a vaccine.
The availability of what's known as therapeutics or medicines to treat people that have contracted the coronavirus and are experiencing severe symptoms. Dr. Steve Hahn of the FDA is here, and he will speak about the progress that we are making, whether it be the availability of remdesivir, which we're distributing another tranche this week, the use of blood plasma, steroid treatments, and also we continue to hear very hopeful signs about the continuing progress toward developing a vaccine for the American people.
In Colombia, the capital will not be going back into strict quarantine after the city received respirators to increase hospital capability to attend to COVID-19 patients. Bogota Mayor Claudia Lopez had warned that the city could be placed under strict quarantine if Colombia's government did not give the district at least 200 ventilators by July 1st, sparking off a storm of controversy with Ivan Duque's government. Schools across Thailand have reopened on Wednesday with coronavirus prevention measures in place following months of closure. Nearly 5,000 students returned to Samkok School wearing face masks and receiving face shields and temperature checks from the school. Old ballot boxes are now turned into classroom partitions to enforce social distancing between the students.
Now, scientists around the world are working on potential treatments and vaccines for the new coronavirus disease. Several companies are working on antiviral drugs, some of which are already in use against other illnesses to treat people who already have COVID-19. Other companies are working on vaccines that could be used to prevent, as a preventive measure against the disease. Well, joining us in the studio is a pharmacist, Deputy Director of Pharmacy, National Orthopedic Hospital, Igbobi, Lagos, Mr. Ekunife Kingsley. Welcome to the program.
Thank you, Millicent, for having me.
All right. Now, we're seeing loads of confirmed cases growing at over 10 million, the death toll over 500,000. At this rate, do we settle for vaccines, treatment, therapeutics to slow the pandemic, to lessen the disease's damage, or push to getting 100% vaccine?
Drugs production and vaccine production is a very complex multi-step process. And they must, whether in the pandemic, they must all go through the clinical trials. So these are for safety reasons. This drug are new, relatively new, and the disease is also relatively novel. So there must be caution. So in as much as there's a hope for the vaccine.
And we're racing against time.
Yeah, we have to use the tools we have to curb the spread of the virus by testing and more testing, just like Lagos State government is doing. I must commend the Lagos State government. The governor and the Commissioner of Health has been in the forefront of this pandemic, and they've been excellent. Continue to do more testing, tracing, contact tracing, isolation, and treatment. It has been found out that contact tracing is, in fact, the most effective means of controlling disease, because WHO has said that the best way of curbing disease is by breaking the transmission from individuals to individuals. So by contact tracing, we should be able to get the people that know the virus. Because you cannot fighting a flame blindfolded. When you get people that are infected, then you isolate them. And by so doing, we curb the virus. So we have to use the tools we have while we also wait for the vaccines to curb the virus.
All right. Today, the U.S. is reported to have bought almost all the world's upcoming supply of remdesivir. It's said to be promising in handling severe cases of COVID-19, but doesn't this affect the global efforts?
Yes, of course it affects it. Remdesivir is not a cheap drug. So last check, it costs about $390 per vial. And each protocol or each treatment regimen is about $5, which costs in Naira equivalent about 150,000. So it's very expensive. Now, there's hope for Africa. There's a company in Egypt, Pharma, that has gotten license from Gilead Sciences, the company in the US that owns the patency for remdesivir. So they're producing, and they've promised that in a couple of weeks, remdesivir will be available for the African market. But that just brings us to the issue of medicine security. So it goes to tell us that we have to look inwards. We have to look inwards at this time of pandemic and look at for the opportunities that pandemic promises us. We have to be able to guarantee our own supply of quality medicines. This idea of importing over 70% of our pharmaceutical products is not acceptable. In as much as we're in a crisis, the crisis also presents with opportunities. And one of the opportunities is medicine security. When pharmaceutical companies in Nigeria should brace up to the occasion to go into manufacturing. And government should support them as much as possible to go into manufacturing so we can sustain our drug availability in this country. Because you see what has happened. Even the Egypt that is producing remdesivir, they've said that it's for the Egyptian market first. Their target is for the Egyptian market first. So we in Nigeria will have to also earn our respect. Let us get involved and see what we can do to produce drugs for our own populace.
All right.
That's when the world will respect Africa, when Nigeria earns its own respect.
We'd like to thank you, Pharmacist Deputy Director, Pharmacy and National Orthopedic Hospital, Igbobi, Lagos, Mr. Ekunife Kingsley. Thank you for joining us on the program.
Thank you for having me.
From BNCDC, 3 out of every 5 Nigerians who die from COVID-19 are more than 50 years old. Take precautions to protect your older relatives by wearing a face mask in public, practicing hand respiratory hygiene, maintaining a physical distance 2 meters from others. You can visit their website and find regular updates on the COVID-19 regulations and guidelines. Now, from the World Health Organization, the website has your questions answered on the disease situation, the latest global numbers by country at COVID-19 cases on a daily basis. You can also find other health advisories, as you can see there. Our website, channelcv.com, has the latest news. All you need to do is log on, access news and health. That's the latest, our breaking story today from Delta State. You can also access news in politics, sports, Africa, news from around the world. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Bye for now. Stay healthy.